Hello, welcome to our coverage of the COVID-19 pandemic. My name is Vivian Kai Loko. In a bit, I'll tell you the latest to this pandemic, how Ghana is doing, and globally what the figures are. And then we'll look at matters arising for today on the COVID-19 pandemic. Remember, the finance minister has also presented his budget on managing the pandemic to Parliament some few minutes or so ago. The finance committee will be deliberating on that, and then we'll see the way forward on that. We'll give you details of all these. Stay with us, we'll be right back. So welcome back to our live coverage of the COVID-19 pandemic. My name is Vivian Kai Loko. Let me introduce to you the panel that I'll be having with me today to help discuss the issues on this pandemic today. I have with me Godfred Boafo. He's with the Citi Breakfast Show. He's also the head of our current affairs desk here at Citi FM and Citi TV. Godfred, welcome.
Thank you very much, Vivian. Always a pleasure.
Great. I also have with me Selom Adono. He's head of features and articles here at Citi FM and Citi TV. Selom, welcome.
Thank you, Vivian. Pleasure.
All right, guys. So it's a good day today when we don't hear any new numbers going up or we don't record any death. It's a good day. But let's start, as usual, with the global outlook. Then we'll come to Ghana. So people will see what is happening around us as well.
All right. Thank you very much, Vivian. So quickly, I'm going to go across the world, and I'm going to start with President Trump.
Okay,
because he attacked the World Health Organization, which is headed by an Ethiopian, Dr. Tedros Adhanom Ghebreyesus.
Yes.
And a lot of African leaders have not taken this line down.
They wouldn't, would they?
Yes, a lot of African leaders have come out to speak, and we've heard from a couple of African presidents who are all saying that, look, now is the time. So the president of Namibia, President Hage Geingob, has come out openly to support Dr. Tedros and how he has handled the coronavirus. In fact, he tweeted this on a thread. And then we've also had Musa Faki Mahamat, who is the head of the AU Commission, who's also come out to say that he's surprised to learn of a campaign by the US government against the World Health Organization's global leadership. The AU fully supports the World Health Organization and Dr. Tedros. Then you have the president of Rwanda also coming in to say, I totally agree. And these are African leaders all on one thread. They've been busy on Twitter.
Busy on Twitter, back to back.
Back to back, yeah. They're just
lockdown.
Yeah, they are responding to each other's comments. They have Paul Kagame who says, I totally agree. And I'm asking this, is it Dr. Tedros, the World Health Organization, China, and the attack together? Let us focus on the fight against this pandemic.
Real fight.
Save us too much politics. Africa does not need it. So that is what is coming on that side. Also, Vivian, quite troubling news coming in from South Africa. We need to take this quite seriously. This is as recent as 12 minutes ago. Now, a hospital has been shut down completely because 66 people, 48 of them members of staff, tested positive for COVID-19. So the hospital has been shut down completely, and apparently this was a cluster case.
So just not to catch you, unfortunately, I just said today was a good day. It's not. The numbers have gone up. We are 313 as we speak.
Okay.
So we'll come to that.
All right.
Finish with
all right.
Global.
So that is what has happened with South Africa, and everybody who has been to that hospital is being checked. Now, primarily, the hospital did not do adequate testing. For patients who had been coming in, and apparently somebody had been there with the virus and did not give the information that he had it. So the person has infected 66 persons.
Is this a patient or a worker?
Patient.
Okay.
So 66 persons based on that, and the hospital has been shut down. This is in Durban. So that is the latest that has come from. Then also a very worrying situation, Vivian, coming from...
You were bearer of bad news today, aren't you?
Yes. That's why people must stay home. In Guangzhou, China.
This is where a lot of you are. You know, you are the Chinese guy. Breaking why this place is important.
Now, Guangzhou is important because it's a trade hub. Now, for the Africans who go to trade in China, everybody lands at the Bayonne airport. Very popular airport. One of the busiest airports on planet Earth. That is where they land. Now, it also has the largest concentration of Africans in China. There's an African city, almost 100,000 plus Africans live in that part of China. Now, a lot of them returned home and have been told that they cannot get access to their apartments and cannot get those in hotels also being evicted. Now, this is because of the new testing policy. But the Africans then, they've interviewed Nigerians, they've interviewed Ghanaians, all kinds of people who are saying that you are told to go for the mandatory test. And after you get a result, you show it to your landlord and then you are allowed back. But they are saying they are not getting the results
as early as
and when you go back, the landlord tells you that they simply it's been taken, it's not available. So that is the situation
and these are Africans who got stuck there during the period.
Exactly, and some are even returning
from other
places, back to go and China is opening up.
But is this mean other nationalities are being asked to do aside Africans or everybody?
This is happening especially with Africans, and they are raising notes on this quickly. Then also staying with China, they are also on research. Because they are one of the few countries that are actually in front of COVID. So they are doing a time where they to try and figure out if people who are silent coronavirus carriers, whether they can set off another cluster. Because here we are under the impression that you can be asymptomatic and you might not pass it on, but they want to see. Just at the moment, the data indicates that a positive test can infect 3 or more people. An asymptomatic person can affect just 1 people. So what they've done is put 1,500 people together and tested all these things to figure out whether this particular data set that we have is actually accurate. So that is what is happening with China. They are actually at the moment testing on.
They've been busy.
Yes, and 68%, according to them, 68% of COVID-19 cases this week were silent carriers. And that is what informed them to carry out this particular test. So that is what is happening. And then quickly on the global numbers before you come to the Ghana numbers. Overview, we are at 1.4 million total confirmed cases.
Just last week we were close to 1 million.
Yes, 1.4.
Within a few days we are 1.4.
Total deaths 83,471, and then total recovered cases 308,215. Italy has 17,127 deaths. Spain has 14,555 deaths, and France has 10,328 deaths.
And you have New York, America. Because yesterday wasn't a good day for them.
Yes, at all. Almost 1,800 deaths in the U.S. with almost 700 plus in the state of New York alone. So total deaths in the United States today stand at 12,911 with 22,539 recoveries. That is my global overview for today.
So it's still gloomy, isn't it?
Very much so. So the government is giving out a global picture. Let me move to how the African continent is looking like. South Africa still tops the African pack with 1,749 cases. They have 13 deaths and they've had 95 recoveries. Algeria is number 2, Egypt is number 3, Morocco is number 4, Cameroon is number 5, Tunisia comes in number 5 as number 5, and Burkina Faso, our neighbors to the north, with 384 cases, 19 deaths, and then 127 recoveries. Ivory Coast, our neighbors to the west, coming with 349 cases, recorded 3 deaths, and 41 recoveries. And Ghana comes in number 9 and has recorded 313 cases, 5 deaths, and 3 recoveries, with a number of people who have been discharged and are on home care or being taken care of in the house or at home. In Niger, when it started, we said a very, warm or hot areas, where we thought in our minds were no-go areas for these. One of the myths. And Niger comes in as number 10 with 278 cases, recorded 11 deaths, and then also had 26 recoveries. So Mauritius comes in as 11. Nigeria has 254 cases, 6 deaths, and also has recorded 44 recoveries. And then Senegal comes in as number 13 with 244 cases, 2 deaths, and then 113 recoveries. Senegal's recoveries appear on the high side. I don't know why.
What are they doing right?
I don't know what they are doing right, actually, but it's something we really need to look at. So basically, this is how the African situation looks like. And when I think that the projection really has been that Africa, in the next few weeks will be the place to watch when it comes to this. In the last couple of days, we thought Europe was getting better, only to realize that just yesterday, the last 24 hours, Spain, for example, recorded 510 deaths. Of course, it is a bit of an improvement from what we've seen in previous days, but 510 people dying, in 24 hours from this disease, underscores the very critical nature of the disease. Godfrey spoke about the USA. USA is leading the pack. US has been a leader in many things. So it appears that in the COVID numbers, USA is leading again with 402,000 cases and 12,000, almost 13,000 deaths. And last night was really, really bad for them, as about 1,800 people died, and about 806 of those coming from New York alone. The implications of these very, very dire for us, because it appears where the African continent looks to are in so much, or under so much pressure to deal with this disease. I think for Africa, what we can do now is to emphasize the fact that prevention is better than cure. And indeed, it is showing everywhere in the world that prevention is better than cure. What we need to do, because our health systems in Africa are not as robust as we have in the Americas, in Asia, and in Europe. So if they have succumbed to this disease this much, your guess is as good as mine if Africa doesn't really
look good for
take
us.
care and
even them, the public hospitals are the ones really doing good and managing these. Some private hospitals are struggling. So we need to be careful with this whole prevention is better. We need to go towards that, because
very much so, Vivian. And just to give some more detail to what Salom was saying, the WHO today, in fact, issued an Africa-specific warning when it comes to COVID. And again, this is for those who are refusing to stay home. This is quite important. Now, Dr. Mashidiso Moeti, who is the regional director for Africa, says that COVID has the potential not only to cause thousands of deaths, but also to unleash economic and social devastation. Now, she says this requires a decentralized response which is tailored to the local context. Communities need to be empowered, and provincial and district levels of government need to ensure they have the resources and expertise to respond to outbreaks locally. Now, she goes on to say that Africa still has an opportunity to reduce and slow down disease transmission. All countries must rapidly accelerate and scale up a comprehensive response to the pandemic, including an appropriate combination of proven public health, which is what you are referencing, and physical distancing measures. Proven public health and physical distancing measures. Within that process, states should target effective control of the outbreak, but plan for the worst.
Okay. So it's a serious one that Africa, and for that matter Ghana, we need to take it serious. So those who are still going out, having no essential thing or nothing so important to go, please stay at home. We are still in the woods and it looks really, really bad. So guys, let's please stay at home. If you don't have anything to do, stay at home. Now the figures have gone up with us. We are at 313. Let me go through quickly why we're there. And unfortunately we recorded another death. So it's now 6 deaths we have recorded. So the regional distribution, Greater Accra is still leading with now 274. Ashanti region 25, Northern 10, Upper West still at 1, Eastern still at 1, Upper East still at 1, and Central region still at 1. So Accra, where we are, guys, is still really going up. Now we are told that of this, a total of 161 cases were reported from the routine surveillance, 37 from enhanced surveillance activities, and those from travelers under mandatory quarantine in both Accra and Tamale in that case. Now, The period for mandatory quarantine for travelers who arrived on the 21st to 22nd of March has ended. In all, a total of 1,030 travelers were quarantined during the period. Out of these, 79, which represents 7.7%, were positive during the initial testing, whilst 951 were negative. Now, 26 among those that were initially tested negative, and yesterday we realized after they did the exit screening they tested positive. So bringing to a total of 105, which constitutes 10.2% among the travelers that were quarantined. Now, with regards to enhanced contact tracing and testing, as at 7th April 2020, a total of 11,016 samples from contacts have been processed, and 37, which is 0.34%, have been confirmed positive for COVID-19.
Yes. So, Vivian, yesterday we were at what,
287.
287.
Yes.
So you can quickly do the math and figure out where we are. But it looks like we now have 7 regions that have confirmed at least a
one
case. Okay,
Yeah.
at least a case. And that for me is a bit worrying because we had always, the numbers still reflect that Accra is the epicenter. If you look at it, 274 cases. Ashanti region has 25, Northern region has 10, Upper West region and Upper East region 1 each, and Central region. But again, I keep saying that some of these regions are more vulnerable than others. Greater Accra is quite robust in terms of the medical personnel that are here, in terms of the physical infrastructure that is here. But the Western region, not so. The Northern region, not too much. The Upper East and the Upper West, far from. You know, and at the moment, it's simply a game of hope. We hope that the numbers there do not increase. The only way those numbers will not increase is if we are responsible and we stay home. So for me, the takeaway is the casual spread of the disease. We started at 3. We started with 2 as epicenter, and we locked it down. We moved to 3, 4. Entering the second week, we are at 7 regions. I don't want people to sit back and say, well, those regions have only 1. 1 is all it takes. One is all it takes. That's why I read the South Africa story, for instance. 1 person entering a hospital has infected 66 persons. So 1 leads to a lot of problems. We do not need
and let's not forget that in Accra we are doing deliberate testing and all that, which is pushing the numbers up. Would it be the same if we do for other regions? So don't think your region nothing is happening, or you just have 1 show so you are okay. Means you know, we need to look at it from all those angles for people to see that this thing.
Until, you see, what people need to understand is this: until the day we get to the point where we are told there is a vaccine, nobody should sleep.
No.
You see, because if you look at the data and the countries that have gone through certain phases of this, as soon as you take your eye off the ball, there is a relapse, and you start getting problems again. So keep your leg firmly on the accelerator and keep going. Obey the rules and keep it as low as possible. The game is not to get overwhelmed. Let's keep it that way. But the numbers that have come, we expect more, because they did 19,000 or so tests. We expect them to do more, 11,000. So we're expecting 8,000 plus results to come in. I am not one of those who will say that when it comes to coronavirus, oh, I am happy we recorded only 10, or we recorded 15, or recorded 40. I want 0. That is the only satisfactory number. 0 is the only satisfactory number when it comes to dealing with this disease. So I am still worried by the regional spread. You know, one day your hope might break and you will have a problem.
Let's bring
it's quite worrying when the numbers go up, really, because that's not what we want. Though moderately, there is expectation that the numbers will have to go up, but go up to what level before it starts plateauing and then declining. When you look at the enhanced testing, 11,000 samples have now been tested and results delivered. 37 now. Yesterday we were told about 7,000 samples were tested with results, and then 33 were positive. Now we've had 4 extra, which brings the number to 37. But we are hearing, or we are told, that the total caseload or the total number of infected persons Ghana has recorded is 313, and that is up from yesterday's 287, some 26 new cases. And so when you take out the 4 new cases from the enhanced testing, you'll be left with, the enhanced testing, we appear to understand what's happening there and how those numbers came about. But we'll be left with 22 extra cases. But the Ghana Health Service doesn't tell us how these 22 other cases got the infection, whether they got them through community infection, whether they got them, whether they were imported cases, we don't know. But for now, I'm not sure we are actually getting more imports because the borders have been shut. Nonetheless, there are a few illegal routes people are coming through. But I think it's important that every time these figures are given, we are given an idea how the condition is spreading. It's so important. We keep emphasizing the fact that we should be careful about community transmission. The more reason why we need to stay indoors, the more reason why the lockdown is as important, than ever, because this thing doesn't work on its own. It doesn't move on its own. Human beings carry it, and we carry it when we move about. So it is quite an important. When you look at the trajectory of the disease, we recorded our first 2 cases on the 13th of March, and it's not even 1 month yet. Today is 8th of April. It's not 1 month yet, and it already appears like we've been in this
for a long, 6 months or something.
Long time. It's simply because of how devastating it is and how everybody is trying to maybe contribute something to it. The underscoring its importance. I think the importance we are attaching to this should go up. We shouldn't relent at all. In any case, the numbers are not going down. The numbers are not the same. So there's no reason why we should remain the same. Today and yesterday, I realized there were a lot of people in town. The security checkpoints were a bit relaxed. The first few days, there were a number of checkpoints which were a bit stringent and strict. They wanted to see your ID card or understand the reason why you were going out before you are allowed to go. But now, coming all the way from the OEB area, I met only one. I mean, the barriers were there or the checkpoints were there, but they were not manned. The only manned place was the university. Even the University of Ghana place, not really manned. What was the Tetekwashi place?
So why are they? Because
I don't know. And I hope it's not this thing I would do as Ghanaians that when something starts, we rush to make a first impression. It is not getting better, and the more reason why we should, make we should be more stringent in implementing the protocols or the directives as given by the president, backed by law. We don't have to relent at all. We have to go in all out and fight. 313 cases. Of course, you can put a context to it and say that we know where some of these cases are coming from, which means we are going after the disease. But we've had a reported case now in Central Region. We need to understand where that case came from, whether that case is one of those people who migrated from Accra to other parts of town after the lockdown was announced. We need to understand that, and the health authorities must be careful to give us these details because it helps our understanding and analysis of things. You don't have to assume that we will just be told that this region has reported 1 case. We need to know how the case came about. The person, did he have any travel history? Has the person been in contact with any known person who has traveled and be declared positive or tested positive? We need to know all these. Where was the person living before? Is it a resident of the town in the last few days? Where has that person been? We need to understand that to help us, in our analysis and help us prepare our minds as to what to expect, etc. Very critical in my view.
And also, just to reiterate that point, if you look at the language of the reports as and when they come, they've changed.
Yes.
Considerably. If you look at the first 2 reports or the first 3 reports, they took into account all the things that Salom was talking about.
And it's important. I mean, it's very important.
For
is it that they don't really know how some of the numbers?
But they have to find out. It's not difficult to find out. They just tell us.
Why are they withholding it?
Transparency in this game is key.
It's very key.
We don't have to leave room for people to speculate or people to throw in what they think the case is there. They need to tell us.
And even when we know, it's easier for us to also manage these things.
Exactly the case. So when you tell people that this case, which was reported here, potentially could affect X number of people, and it was because this person moved from maybe Accra to this place when the lockdown was announced. I'm just speculating.
Yeah.
So, which is not a thing to do.
Yeah.
If they had given us those details, I'm not sure anybody will be speculating.
Yeah.
To a large extent, people have come to agree or trust the information the Ghana Health Service gives us on their website. And I don't think they need to lose that trust. Once people have other means of verifying and confirming information otherwise that should have been given by the Ghana Health Service, they would have been compromising the trust that the Ghana Health Service has in this matter from the public, and that will not be good for us.
And also, we will note again the point on exit test from the mandatory quarantine squad. 79 were positive during the initial testing, 151 were negative, but of the 951 that were negative, 26 among those that were initially negative were found to have converted to be positive. You see, that is why it's important, like I said, nobody should relax at all. We don't have room for relaxation.
It's not over till it's really over. So, Finance Minister has gone to Parliament this afternoon. He was in Parliament. He has presented his budget for the coronavirus alleviation program. He's seeking 1.2 billion, around that. If you permit me, I can go through the 1.2 billion, where it's going to. Okay. Then we'll take them one by one. So for the support to households, he's seeking 280 million. Food package and hot meals, which everybody has been pushing that we should feed the poor, the homeless. He's hoping to take out of this 1.2 billion, 40 million from that to pay for that. Ghana National Buffer Stock Company looking for 40.30 million. Provision of water and sanitation. The water that you people are saying we should have, we need to wash our hands and all that. That's going to cost us 200 million if this goes through. Now, relief for health workers is going to cost us 323 million. Waiver of personal income taxes for all health workers for 3 months. The nation will lose 241 million in taxes from that. Allowance the 50% basic salary for all frontline health workers. For 4 months, the nation is losing 80 million. And then the Basin, the Ayalolo thing of workers in Accra, Tema, Kumasi, and Kaswa to and from work for the duration of the lockdown. I don't know whether this is just because they specifically say lockdown. I don't know, for 1 week or an extension or whatever. It's going to cost us as much as 2 million Ghana cedis. And then 600 million will go into soft loans for micro, small, and medium sized businesses. So in all, we are looking at 1,203.72 Ghana cedis. Yes. This is what is going to cost us. For now, this is just a budget for this.
Even more reason for me to reiterate my point. Stay at home.
Yes.
3 or 4 months, 1.2 billion. You don't stay at home and this disease does not go away. The numbers go up. The economy weakens. Already we are being told that projections are that the economy is going to grow slower than it has in the past 37 years because of this
because there's no oil to fuel any of your sectors. No oil, because all your sectors are struggling to breathe. So
people need to pay attention. I look at the numbers, support to households. It's in the how, really, that the questions arise for me. The food packages and hot meals, they found a good way of doing that, I think, with the churches. At least it's with the churches and the mosques. And charity organizations. So they can deal with that. The Ghana National Buffer Stock Company as well, provision of water and sanitation, which is the free water and whatnot, 200 million Ghana cedis. But I also wonder what happens to the original budget of the sanitation ministry, because they had a really heavy budget when the budget itself was read, because they were supposed to undertake certain projects within the entire country ahead of the floods and for sanitation. So they have a really significant budget in addition to this. So we might have to find out what they are doing. Relief for health workers also comes in there. That is a total of what? 323 million. You have waiver for those ones again already. We know how that one is going to happen. The third one, the 600 million Ghana cedis one, soft loans for micro, small, and medium-sized businesses. Again, the how is where the questions lie. How are you going to identify these companies? how do you make sure that they make good use
of the money,
that you are giving them? And let's not deceive ourselves, Vivian. We need the money to keep the economy afloat. Even greater stress than it already is. We need this to be able to stay afloat. And some interesting numbers came in this morning from the International Labour Organization. And if you look at the numbers, Vivian, the number of people who are going to lose jobs in terms of projections. Now, they are basically saying that they are looking at a global unemployment rate that will go to roughly 190 million. Now, 25 million jobs are currently threatened by the coronavirus. And according to the ILO, the latest assessment they've done is that the full or partial lockdown measures globally is affecting almost 2.7 billion workers. Work minutes have gone down. If you look at Africa, for instance, 19 million workers at the moment are working less than 48 hours.
That's right.
Productivity has diminished. So all these things are going to have an impact on an economy like ours. So for me, it's about making the best judgment with who to give the money to. For instance, on the soft loans for micro, small and medium-sized businesses, the companies that get access to this money must be companies that we need to run for this economy to survive. This is not what you do. The
critical ones that we need to really get them run so we can breathe a bit.
Certainly. This is not what you do, friends and family.
So we need to see into detail, like you're saying, how they are going to do that.
The how, basically, is the most important for me in two cases. The soft loans for micro, small and medium-sized businesses, and then the support for households. Because, tell them, the question then again becomes, how do you determine a household that needs support?
Exactly.
Because you might see a house. This looks like a decent house,
and
but they come and tell you we need support. How do you determine whether they need support or not? By how the size of the house? Because we do know that there are certain people who live in informal places who actually might have greater means, but choose to live there for other reasons.
Proximity to workplace.
For all kinds of reasons. I, for instance, know a multi-millionaire footballer who chooses to live in Buko.
I know one as well, where he's built a nice place.
He lives in Buko.
And he's okay because he wants to be that setting.
That is where he wants to be. You will find him sitting with his friends every morning at the square, chatting. So how do you determine these things? So the how, for me, is the most important.
When you see a nice posh house, probably the two main people bringing the money have lost their jobs, and all those things come up.
And for instance, the banking sector, there was a message that somebody sent to Bernard on the morning show. A man who said that he had lost his job in the banking sector. His wife was the one providing for the house. His wife has been let go in the first week of this. So income is not going to come in. At least they know for April, May, June, they're not going to get any income. They might, prior to this situation happening, they might have been okay. But if this person approaches you now
the main breadwinner is out.
I need support for my household, you look at the person and say, but I live at Dansuman Estate, Gattisburg Avenue. What indicates that you need support?
Need this money. So we need to know how they are going to go about
this. The how is important, Selim. I don't know if you have any thoughts on that.
The interesting thing, I'm just looking at the
figures.
The figures again. Support to households. I wonder really what that means, what they mean by household. And does household mean just providing food packages or hot meals? I don't know. Because there is nothing like a stipend or giving handouts to people in this. National Buffer Stock Company, 40 million cedis. I don't know how, of course, the devil, they say, is in the detail. We are yet to see the detail. But what is the buffer stock going to do? Are they going to buy food and then store it for a leaner period? I don't know. Hopefully so. Provision of water and sanitation. So does it mean that the provision of water maybe will be going to households? So that qualifies, or that explains why they say support to households. Because very interesting point Godfred raises. How are you going to determine that this household needs money, for which reason you give the person some money? I don't see that here. So the support to households, because food normally is from home, I assume that it's part of it. So food packages, provision of water, that is the only inference I can draw from this. There is nothing like giving stipends or giving allowances to people as we do for the LEAP people. And even that is not even captured here for the LEAP people, like giving them the handouts through mobile money and other electronic means. We don't see anything like that here. The only thing we see basically here is food and water. And in terms of provision of water and sanitation, 200 million cedis. That's quite a lot of money. I would ordinarily have wanted to see how much for a 3-month period the Ghana Water Company makes from its normal operations. I mean, minus this lockdown, how much they make, so that maybe we can now ascribe the rest of the money to the sanitation. And what does the sanitation mean? The fumigation of markets? Are we going to construct new storm drains? What does it mean? We need to understand all these so we appreciate the figures better. Again, this is just the figures, and I'm sure the details will be in the rest of the document that we made available soon. Relief to healthcare workers.
So just a bit of information so that you can continue. I'm going through the details of the document sent to Parliament. So, for instance, on the small, even if you can read that last portion for me, on the support loans to businesses,
soft loans for micro
government in a soft loan scheme, which will have a 1-year moratorium and 2-year repayment period to micro, small, and medium-scale businesses. Now, this is what the interesting part is. Beneficiaries will be micro, small, and medium-sized enterprises that have been hard hit by the coronavirus pandemic. Again, determining how has the company been hard hit. 2, each beneficiary will be required to belong to a recognized trade association. And 2, have a tax identification number, which is 3, which is the TIN, and 3, have a bank account or mobile money account. Now, the Ministry of Finance and Ministry of Trade and Industry will enter into an MOU with the selected commercial and rural banks for the disbursement of loans to the selected businesses. The MBSSI will develop the criteria for identifying beneficiary business and provide business development support. So this is what they say they are going. This is how.
And also,
this
MBSSI today announced they had gotten some $90 million from MasterCard for the same purpose.
Okay, so they
so
can
I
add
don't
it
know
to
whether
that.
this is all part of it. Okay, so we need to get better.
So some details are emerging.
Okay,
so
great.
In terms of the support for households, I mean, bust the bubble. They are not going to give cash to families.
Okay.
So I think basically it's just about food. You know.
So what kind of households? Any household who needs food?
So I read paragraph 9 of it, or bullet point 9. The support will be in the form of dry food packages and hot meals.
Okay.
The support will be delivered to vulnerable communities in the areas affected by the lockdown, including Accra, Tema, Kumasi, and Kaswa. Distribution has already started in the lockdown areas. Beneficiaries will be the most vulnerable, who have been hard hit by the coronavirus pandemic, including individuals below the extreme poverty line, such as head porters,
so how is
and
that
street hawkers.
different from the food package and hot meals? We have support to household 280 million, then food packages and hot meals 40 million, very separated. So now we're having more confused.
No, let's see. Say that again, Vivian.
So the first one, if you look at the budget, support to households, they say 280.
No, so I think the support to household is the headline. So that's the total.
So that's the breakdown.
So the breakdown. So if you look at it,
okay, you're right, because provision of water 200.
Okay. So when you add that gives you.
You're right, that gives you. Yes.
So let me continue. Yes. So the Ministry of Gender, Children and Social Protection, Ministry of Local Government and Rural Development, and the National Disaster Management Organization will work with the MMDCs and faith-based organizations to provide food to beneficiaries. The initial coverage will be up to 400,000 individuals and homes in the lockdown areas. This support will be in addition to what has already been programmed for beneficiaries of LEAP. We need to know what has already been programmed for the beneficiaries of LEAP, because they are the people we have identified as the poorest in society.
Yeah.
Okay, so F says that government will procure additional food items under the Ghana National Buffer Stock Company. Okay, so that explains why the buffer stock is getting 40 million. Okay. Government will also absorb the water bills for all Ghanaians for the next 3 months, that's April, May, June. And then government will mobilize all water tankers, publicly and privately owned, to ensure the supply of water to all vulnerable communities. All health workers will not pay taxes on their emoluments for the next 3 months. It also continues to say that all frontline workers will receive an additional allowance of 50% on their basic salary. We know that. The Transport Ministry is also making available Ayalolo buses to convey health workers. We know that. So other government interventions to support Ghanaians include, so the water company and electricity company of Ghana have been directed to ensure stable and adequate water supply. This morning my tap wasn't flowing, though they have been directed to ensure.
Please, which area is this?
I mean,
so if they are listening, they help you out.
I'm around the OEB area.
Okay.
After the directive by the president, and yesterday we had intermittent power outages.
And the parts are still not getting water. So please, if the Ghana water.
So we hope the directive was not just issued at the top, and the guys down there to make it happen are doing business as usual. There will also be no disconnection in supply of electricity and water supply during the lockdown period. We heard the minister say that yesterday. An insurance package for healthcare workers, 350,000. The president said that, and a daily allowance of 150 cedis will be paid to health personnel and allied professionals, contact tracers. The expenditure will be borne out of the $100 million budget for the COVID-19. So what does this mean? The healthcare workers will be getting 150 cedis per day.
Yes.
Yes.
In addition to their salaries.
Yes.
Minus taxes.
Yes, please.
Plus 50% basic salary.
Yes, please.
But it's actually a good time to be a health professional.
So that's it. But guys, the media is saying that they have to be added to one, the stimulus package, and two, they must also be picked up by the Ayalolo bus. So today, GJA, and then Primpack and all that are saying that, wait a minute, guys, frontline people is not just health workers. We are all frontline people. I go out there, I get to report. When I go, my life is at stake because I'm still mixing with people, I'm still interacting with, I'm still likely to pick anything, this virus, because it's moving. So you need to add us to the definition of frontline persons. And then two, when you're picking the health care workers, a lot of media houses, it's not everybody who have the luxury of getting the cars, and then those who are even getting cars to pick people, they are all struggling and all that. So why don't you add us to the health workers, whilst you're at it? It's a good idea, or no?
It is, though I'm conflicted.
Let me start. Okay. Let me start with this one.
Why in part? What is your problem?
Picking up, I don't have a problem.
Yeah.
I think that if the government can support journalists to go from point A to point B, because information dissemination on COVID
is critical.
It's critical. Okay. So the picking up part, I agree. The stimulus package, I disagree.
A lot of media houses cannot breathe during this period. A lot have had to cut numbers, even looking at the social distance in the numbers, you need to let people stay off. And a lot are not even getting any revenue from their usual revenue basis and all that. And you think they shouldn't be part of
the ethos of the media business is such that taking any kind of relief from a government
they'll be compromised?
Leaves the potential to be compromised. Now, you can only speak for where you work, but if you do a general assessment of the media space in Ghana, and I'll be honest with you, we have too many media houses. One, I can say, I can give a rough estimate and say about 60 or 70% of these media entities are not in robust health on a normal day.
Okay.
Because they are not properly run. We all know what happens in the media space, and so you suddenly start providing a stimulus package to these entities that have decades of running themselves to the ground poorly, the potential to compromise coverage and independence. That is too much of a risk in the kind of political setup that we have. I don't think that we trust ourselves, and we are developed enough for media entities, private media entities, to go to the state for a stimulus. If Daily Graphic and Times,
so the public owned ones can go, but the private
ones, they need to see this through.
How do they breathe then after this?
That is why you are encouraged to unionize. Now, in unionizing, we have members some have chosen to be part of GJA. So, for instance, this is where GJA's welfare comes to the fore. All the dues that you've been paying and whatnot. GJA should be able to say, okay, this is what we've been able to put together for you. Through that channel, than giving it directly to a media house and saying, okay, I'm making accessible to you 2 million Ghana cedis that you can touch.
Yeah.
And then maybe in 6 months, I need a story going a certain way. And I call you and you tell me you won't do it. It won't happen, Vivian. So for me, yes, I agree with picking journalists up and getting them to work. But the chips must fall where they must. And it is the same globally. The chips must fall where they must. Even prior to the COVID, a lot of media houses were shutting down across the world. Newsrooms were becoming smaller across the world. It is what it is.
So we should stay, I suppose the private ones should stay away from this money.
Very different ways, but you know, buses picking journalists, that's fine. I wouldn't have a problem if journalists are paid. If they want to stretch it, journalists can pay for the service just so they have some money to support buying fuel, etc. Because the budget has been made 2 million cedis. We don't know how long it's going to last because they just said for the lockdown. Doesn't mean the lockdown stretches to 6 months, which we don't want to. This 2 million will still be enough. This is just a budget, so it's an estimate. That's fine. But you see, the media houses will struggle a bit if this support is not extended to them, because a lot of companies we know will struggle. And you see, in budgeting and everything, if you are stretched, there are parts of your budget or institutional budget to cut down on. So you cut down on marketing, you cut down on advertisement, you cut down on things like that. And it's at the marketing and advertisement side that the media also will get its money. So if you are cutting down on advertisement and marketing, then it means that you are drying up the lifeline to the media houses, which makes them susceptible to struggle and maybe shut down. We don't want a situation where media houses, even the top ones, will not be able to pay their staff, so their staff will leave. That will leave our democracy crippling. What I suggest is that they should extend the facility to all businesses. The criteria must be robust, the criteria must be rigorous, and the criteria must be fair and transparent and clear, so that when you meet the criteria, you should be looked at. If media houses do not want to go directly to the state, and that's the consensus, then the NMC comes in, the Ghana Journalists Association and all those other bodies come in. We should decide which body will administer this. So, for example, the state or government can say we are making X million cedis available to media houses. Those of them who qualify, this is the criteria, if they qualify, give it to them. Again, the point about media houses being compromised, you see, if it were just one media house, then we can understand. But if we have 10 or 20 media houses going for a loan, it's not a gift, going for a loan, and we get it, and we get it, and tomorrow we are doing our job, and government will come and say, because I gave you a loan, to my line. I think media houses worth their salt will not succumb, because we are doing the job. And in any case, the money you give to me, it's not your money, it's our money you are giving back to us, and we will pay later, because the terms are clear. 1 year moratorium, 2 years payment period. So I think media houses equally need this money. April, May, a lot of media houses will not be able to pay their people. And
that's true.
We don't want that to happen.
So if there's a facility available to small-scale enterprises, I think a lot of media houses can qualify as such. And we must just ensure that the modalities are clear, fair, transparent, so that anybody who takes it is held to the same standard, and we can all pay. At least, I mean, I'm saying I'm conflicted, but it's necessary to make the case. We make the case for a lot of people every time. It is a case we must make for ourselves. It is something we must do.
So brilliant from both of you. We'll see how it goes. Whether
everybody don't understand that. The free food.
Yes.
We come to work. We have to roam to get food. Thankfully, we bring Citi gets food.
We get food.
But how many media houses working can go out to look for food? Because a lot of the food joints have closed. I don't think it will hurt.
And it's not even safe to be moving around looking for food.
In fact, it should benefit us too.
We are fortunate, we get breakfast and lunch and all.
Before you get rid of Solomon, and I have 2 minutes to give me 2 minutes to discuss something.
We are going to the last, so you can have 2 minutes.
Then you go to yours before, because mine are just observations I've made regarding this. So let's.
The final thing I wanted us to touch on it comes back to health again. While we are busy dealing with COVID, we are struggling to get blood. So there's a shortage of blood in Accra, Tamale, and Kumasi, our blood banks. And the same thing with the meningitis we are seeing. So, I mean, whilst we are busy looking elsewhere, there are issues. So just a quick one on that, then you can deal with it.
Something has always stuck in my head when I interviewed the man who has been nominated as the Deputy Health Minister, Dr. Okoboy. He said, let us be careful that we do not make, we do not treat COVID at the expense of maternity health, at the expense of malaria. You see, because prior to COVID, there were a lot of diseases that we were struggling with in this country.
Yes.
Those diseases have not...
Nothing. They've not said, okay, we are holding on for you to deal with COVID. No.
They are still killing people. Yes. You understand? People still go to the hospital for treatment for those things. Those who need dialysis go. Yeah. Those who are suffering from hypertension. Those who are getting strokes are getting it. Well, all kinds of diseases.
Nothing has changed.
So nothing has changed. There's just more pressure on the health system. That also requires people to give a bit more. Blood is essential. Constantly, the blood bank comes out to cry out, people should help us, people should help us. Because you do not know when you need blood until you are the one lying there who needs blood. So for those who can give, anytime you have an opportunity, let's go out there and provide the blood. If you are healthy, you can give it. Go out there and give it.
Now with the lockdown,
I think it's critical. That would be an essential service. I mean, blood is key. A lot of, you see, we don't have to let, like Godfrey said, we don't have to let the COVID-19 make us forget about other conditions. Before COVID-19, our hospitals were already congested. People were being treated from the floor, corridors, etc. You know, I'm not sure that situation has changed much, or maybe now they are focusing on emergency cases. I don't know. We don't have to behave as if COVID has come to end all other conditions, or it's mutually exclusive. No, the other conditions are there. So it will be important for the health service, for our health system to have an important focus on COVID. Great, but they should also focus on the everyday health problems. So, for example, what is happening in Upper West region should not happen. If you look at the figures we've recorded in the last 2 months, 33 deaths is been high when you look at the figure from previous years, simply because, in my view, a lot of attention is shifted from that onto COVID. 33 people have died. Meanwhile, the COVID, we've lost 6 people. That's also a huge number. But 33 lives against 6.
15 in 2 weeks.
15 in 2 weeks.
Crazy.
I mean, that is a serious matter. We don't have to forget about other things. Now, about the blood issue, I think the blood bank, how do they call it? The Ghana Blood Bank. I mean, the organization must do something different. They must start running ads on radio stations. I'm sure now a lot of radio stations are very compassionate in this moment. I'm sure they may agree to run a few adverts for them. Let them set a date or a time, and let people at the big place, and let people who are willing to donate blood come and donate. It could be a big hall, it could be a big park, bearing in mind the protocols of social distancing, and let donate blood. Life shouldn't stop. People continue going to the hospital to give birth. Women get into critical conditions during childbirth, and they need blood. We don't have to close our eyes on that. So they need to get innovative and get something out there for people. And a lot of people are indoors; they are eating a lot. I mean,
so
people must donate blood. It's a good way to balance this off.
Please, you have 1 minute.
Vivian, just this afternoon, statements from Government and Hospital Pharmacists Association, GOSPA. Now, as a journalist, Vivian, I have never been more inundated with statements from associations
in the health sector
than the past 2 weeks. Everybody asking for definition of frontline health worker. Because now the definition of frontline health worker has to do with money. My point is this, and nobody should put me financial arrangements. You see, for those of us who've been covering the COVID prior to it hitting Ghana and other places, health personnel there did not have time to think about this because they were busy dealing with too many deaths. Ours seems to be quite casual, so people have taken it as another opportunity for labor agitation. I think it's wrong. I have not said they do not deserve what they deserve, but COVID seems to rather have provided an opening. We heard those who are doing contact tracing who said
after that
this is not employed. No, in the course of it, they don't say after. In the course of it, if you don't pay, if you don't promise to employ us, we will stop the contact tracing now. I do not think it is the right kind of spirit to be engaged in this. And touch wood, I'm saying we do not want to get to the absurd cases that we are reporting on globally. Ours already is a problem for us. Let us reduce it as it is. But touch wood, if we have to start dealing with some of those significant numbers, you actually think, Gospel, you will have time to write to me about
a word
who
or a line
a frontline worker is at this point? So I think we can do better than that. Let us move on from here. It's not time for labor agitation, opportunities. It's time to be proper Ghanaians.
And also we are seeing people, nurses and doctors who are at home, leaving prime ministers. And so I think one of the prime ministers in Europe or so, he's now doing 6 days in a week just to take he's a doctor. One of them, So people are sacrificing. Let's sacrifice.
It's important. We need to be Ghanaians. And the promises we make to people, we must ensure we fulfill those promises. In terms of Frontline, when the president announced the package for all health workers and then frontline workers, health workers, I knew there was going to be a problem. So now he came back later in the meeting with the GMA to say that they were working at a definition for frontline workers that will satisfy everybody. And let me just take this quote. The effort is being made on the part of the government to arrive at an acceptable definition. And I think your input, as referring to the GMA, will be very necessary and required so that we get a definition that makes sense for everybody and which addresses the issue of people who are also in the front line, as it were, of dealing with this disease. Yesterday or 2 days ago, we also raised issues about the front line. Who is the front line? A frontline health worker. The one in the lab testing, doing the tests, is a front line. The one who goes out there to trace the contacts, will you call him front line? The doctor who sits in his consulting room and sees the patients, is that front line? So we really need to be careful about what the front line definition will be, so that we don't have agitations coming from everywhere. Very, very critical.
Okay, gentlemen, thank you so much. Godfred Akotobuafo, he's head of current affairs, also with the Citi Breakfast Show on radio, and then Salam Adono, head of features and articles here at Citi TV and Citi FM. You've been fantastic joining us. Join us again tomorrow. But in the interim, you can go to our website. We still have information on this pandemic. You can stay with us on radio. We still have information, and on TV as well. Thank you so much for joining us. My name is Vivian Kai Loko. Goodbye.